Welcome to Pathophysiology. You can find the following information in Chapter 1 of your Pathophysiology textbook. The term pathophysiology is defined as the physiology of altered health. According to the preamble to the Constitution of the World Health Organization in 1948, it defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The focus of this class is the study of pathophysiology, the study of the body's response to dysfunction or disease. The definition of disease is an interruption or cessation or disorder of the body system or organ structure that is characterized by four recognized requirements. 1. An etiologic agent or agents. 2. Clinical expression of identifiable signs and symptoms. 3. Consistent anatomical alterations. And 4. Pathogenesis. The aspects of the disease process include etiology, pathogenesis, morphologic changes, clinical manifestations, diagnosis, and the clinical course. I will define these topics on the next few slides. The causes of disease are known as etiologic factors. These agents can be biologic, such as bacteria and viruses. They can be physical forces, such as trauma, burns, or radiation. They can be chemical agents like poison or alcohol. They can be nutritional excesses or deficits. And there can be a molecular source, such as in sickle cell anemia, where a gene mutation results in the insertion of a valine amino acid at position 6 instead of a glutamate. Most disease states do not have a single cause. Instead, the majority of diseases are multifactorial in origin. A risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease. Physicians like to group agents that cause disease into two broad categories, congenital or acquired. If the agents were present at birth, they are called congenital diseases. However, their manifestations may not be evident until later in life. Acquired diseases are those that are caused by events that occur after birth. For example, in the bottom picture of this slide, you see a man with gross skeletal deformity he acquired due to a nutritional deficiency combined with exposure to high levels of fluorine from domestic coal combustion. Pathogenesis is the sequence of cellular and tissue events that take place from the time of initial contact with an etiologic agent until the ultimate expression of the disease. Pathologists often start with the disease and work backward to the initial contact with the etiologic agent. Morphology refers to the fundamental structure or form of cells or tissues. Morphological changes are part of the pathogenesis in a particular disease. These changes can be on a macroscopic level down to a molecular level. Clinical manifestations are also aspects of disease. When we think of clinical manifestations, we think of signs and symptoms. A symptom is a complaint that is given by the person or patient with the disorder, whereas a sign is a manifestation that can be observed by the physician. For example, having difficulty in breathing and dizziness are symptoms of the disease. These would be complaints the patient would give the physician. An elevated temperature that can be measured, a swollen extremity that can be palpated, and changes in pupil size are objective signs that can be observed by someone other than the person with the disease. It is important to note that signs and symptoms may be related to the disease, or they may represent the body's attempt to compensate for the altered function caused by the pathologic condition. A syndrome is a group of signs and symptoms that go together for a particular disease. And a complication is a possible adverse extension of the disease or outcome of treatment. For example, a complication of uncontrolled diabetes mellitus is the development of sores on the feet, and this is due to poor blood flow and nerve damage. Another example of a complication could be a person with rheumatoid arthritis taking a high dose of NSAIDs, and this leads to the destruction of the protective qualities of the stomach, and so the person may present with ulcers. When we think of disease, it is important to understand that the diagnosis is the identification of the nature and cause of a health problem. A physician will take a patient's history and obtain their accounts of their symptoms and their progression of the disease. A physical examination is done to observe for signs of altered body structure or function. Developing the diagnosis involves weighing competing possibilities and selecting the most likely one from among the conditions that might be responsible for the person's clinical presentation. An important factor when interpreting diagnostic test results is the determination of whether they are normal or abnormal. Normal values for laboratory tests are based on values that refer to the greater 95% of the population, meaning the greater majority of the population presents with a similar value. What about the clinical tests that are frequently part of the diagnostic process? There are a few terms to understand when thinking about clinical tests: reliability, validity, sensitivity, and specificity. When we think of reliability, this refers to the extent to which an observation, if repeated, gives the same result. For an example, a thermometer should take the same temperature if you took your temperature 3 times in 10 minutes. Validity refers to the extent to which a measurement tool measures what is intended to measure. Another way of saying this is, does the tool or test give us a similar result when comparing the patient's value and the true value? The picture on this slide illustrates this point and leads to 2 terms that fall under the validity term: sensitivity and specificity. First, the picture. If a test says a patient is positive, let's say for a disease, and the patient displays signs and symptoms of the disease, we say this is a true positive. If, however, the patient doesn't display the SNSs, signs and symptoms, of the disease, we say it is a false positive. Of course, let's not add to this discussion a possibility of an asymptomatic carrier of the disease, like in many COVID-19 people who test positive but don't display SNSs. If a test says a person is negative, but the person shows SNSs of the disease, then we say it is a false negative. If the person doesn't show SNSs, we say it is a true negative. Now, what do the terms sensitivity and specificity mean? When we speak of sensitivity for laboratory testing, we are referring to the proportion of people with the disease who are positive for the disease on a given test or observation. This is called a true positive result. For example, if the result of a very sensitive test is positive, it tells us the person does have the disease. Specificity refers to the proportion of people without the disease who are negative on a given test or observation. In this aspect, the test is specific for the disease being tested and isn't cross-reacting with some other disease source. This is called a true negative result. A funny example of this would be from my graduate school friend, Dr. Zoe. When he suspected that his wife was pregnant, he would buy 2 pregnancy tests, one for his wife and the other for him to urinate on. The point of that was to demonstrate the sensitivity and specificity of the pregnancy test. It should be sensitive enough to detect human chorionic gonadotropin and specific enough to not cross-react with other hormones like testosterone. Of course, we don't think of the pregnancy as being a disease, but the point of the test was to show that Dr. Zoe's wife was pregnant, that's sensitivity, and he was not, specificity. To go along with this example, if Dr. Zoe had his wife take the pregnancy test too early in her pregnancy, the test may not be sensitive enough to detect the pregnancy hormone, and this would have led to a false negative. The health of individuals is closely linked to the health of the community and to the population it encompasses. Diseases that were once confined to local areas of the world now pose a threat to populations throughout the world when we consider that people can traverse continents in a matter of hours. A very real example of this is the COVID-19 pandemic. Once news of its spreading was known, many countries tried to put their borders under lockdown to discourage people entering and exiting. Epidemiology is the study of disease occurrence in the human population. Epidemiologic methods are used to determine how a disease is spread, how to control it, how to prevent it, and how to eliminate it. Measures of disease frequency are an important aspect of epidemiology. Disease incidence reflects the number of new cases arising in a population at risk during a specified time. For example, 10 new cases per 1,000 individuals per day. As of May 24th, the incidence of COVID-19 was 4.7 new cases per 100,000 people in the state of California. Prevalence is a measure of existing diseases in a population at a given point in time. For example, yesterday 100 people out of 1,000 total had the flu. Today, 110 people per 1,000 people. Incidence and prevalence are always reported as rates. Mortality statistics provide information about the cause of death in a given population. Morbidity describes the effects an illness has on a person's life. An example of mortality rates can be seen in the COVID-19 fatalities in the United States. Currently, 97,669 deaths have occurred from COVID-19 out of the 1.64 million confirmed cases. An example of disease with a high morbidity but low mortality is arthritis. People with arthritis have low mortality from this disease, but arthritis certainly has a significant impact on the quality of life. That is, high morbidity due to pain and poor movement. When epidemiologists consider prevention of disease, there are typically 3 levels of disease prevention. Primary prevention is directed at keeping disease from occurring by removing all risk factors. For example, when a woman is pregnant, we would like her to be on a prenatal vitamin that is high in folic acid and vitamin B12. These vitamins are required for DNA replication. A deficiency of these can lead to neural tube defects in the child. Immunizations given to children and the elderly populations with compromised immune systems are also designed to help prevent communicable disease. Secondary prevention detects disease early when it is still asymptomatic, and treatment measures can cure or stop it from progressing. For example, when a woman goes in for her annual well woman exam, a pap smear is done for early detection of cervical cancer. Another example of secondary prevention would be a blood pressure measurement during an annual physical examination. It would detect hypertension, and the patient can be counseled for changes toward healthier lifestyle techniques. Tertiary prevention is directed at clinical interventions that prevent further deterioration or reduce the complications of the disease once it has been diagnosed. For example, chemotherapy would be an example of tertiary prevention. The chemotherapy targets rapidly dividing cancer cells and is used to hopefully halt the invasive nature of the cancer to surrounding healthy tissue.